Hi everybody, thanks for coming to Myofascial Freedom. What we're going to talk about today are some stretches that you can do on your own in the comfort of your home to help various places in your body to feel better. So today I'm going to cover the hips and low back. My name is Jane Franzak and I am the owner and physical therapist at Serendip PT. So here are a few principles to keep in mind as we go through these. Myofascial release works on elongating tight connective tissues. So what you need to think about is yourself, your body. Focus on the tension that's deep inside. Stay present as we are doing these exercises. Take your exercise just to the barrier, just to where it starts to feel like a stretch, but not so far that it actually hurts. Stay there and wait. Allow that barrier to release, and then take up the slack and go a smidge further. Once that barrier releases, go to the next barrier and wait. Soften, breathe. When that barrier has been released, I want you to go to one more barrier and wait and soften. All of that should take you about 1.5 minutes to 2 minutes. Continue to breathe. Continue to elongate and telescope. By telescoping, I mean reaching, elongating your arms, or lengthening your spine and feeling the space between all of the joints. So with that being said, let's get started. Hop onto a comfortable surface, such as a table. Get yourself nice and comfortable. Now we're going to do a double knee to chest stretch. Pull one knee in. Pull the other knee in. Hold them. You should feel a stretch down here at your low back. Continue to breathe. Pull them in just to where you feel that stretch. Softly release the tissues. When that barrier releases, take it a smidge further. I'm rocking back and forth so that I can release the tension in my low back and make sure that I have all of that tissue in a good place that helps me to release. Keep breathing. Pull them in one step further. Stay present in your body. Keep releasing. Taking up the slack. And breathe. Now I'm going to go a little faster just so that I can demonstrate all the stretches for you today. So when we're finished that one, put your legs back down, cross one leg over the other. Now we're going to stretch the outside hip and buttocks of my left leg. Pull this leg in, take up the slack, and wait and soften. Keep breathing. If that starts to soften and release, take up the slack more. Continuing to release. Continuing to soften. You know, typical physical therapy says to hold your stretches for 30 seconds and then do them 3 times. Myofascial stretches, we tend to say hold them continuously for 90 seconds, all the way up to 120 seconds. Continue to elongate, stretch. So we're not just releasing the elastin, we're releasing the collagenous barrier in our tissues. Those typical stretches being held for 30 seconds are only reaching that elastic component, so they are not lasting changes that you're creating. Whereas with myofascial release, we're creating effective, lasting stretches that is going to undo those tightened crosshatches that have formed inside of all of your tissues. Bring fresh oxygen to the area by breathing, relaxing, softening. You might take the stretch off to the side a little to emphasize that. Continue to play with that stretch and see where in that range does it feel most effective. When you're finished that leg, Cross the other one over and wait. I'm taking it a smidge further, again going faster than we really should when practicing, but it's just for demonstration. This is called the figure 4 stretch. Our first stretch was a double knee to chest. Pulling it in, taking up the slack, breathing. So let's say we've been through all 3 barriers. We could release that. We could do a stretch that is a lower trunk rotation. Pulling that back in, going to the other side. Come to the edge of your table, allow one leg to fall off the side, and stretch out your hip flexor. Having the opposite leg bent is going to help you to keep your back flat on the table and prevent any injury to this region. Soften and wait. You would do the same thing on the other side. Now let's go up to baby pose. Come sit up, flip yourself around, sink down onto your heels, drop your chest down, feel the stretch through your low back and hip region. You might even take the legs apart and go even farther down, stretching open, thinking of how babies elongate and stretch through their buttocks and hip and low back region. You could take that stretch off to the side and feel it more on the left side. You could take that stretch off to the opposite side. And one last stretch would be to stand up and do what's called hamstring elongation. Drop your chest down to the table, walk your hands out. My hips are slightly behind my feet. So my feet are in closer to the table, the hips are backwards, chest is down. I can feel that stretch up the entire leg. Slightly bend one leg. I have bent my right leg, so I feel it more on my left. Switch them. Allow yourself to feel it more on the right leg. Straighten both legs. Walk yourself up. And the last piece we're going to do is a full trunk stretch. Upwards, outwards, take the legs out, telescope, elongate. Deep breath in. Take that all the way down. Thank you for joining. We'll try another one of these another day.